Hello, my name is Dr. Phil Davies. I'm speaking to you from my practice in Hampshire. Now, we've been doing a series of videos for our practice population and the wider UK population dealing with the current pandemic. Now, those videos have been loaded onto our website at thevirus.uk. This particular video is a summary piece targeting our patients over 65 years. Now, patients in that group are slightly more vulnerable to the virus. The virus tends to present in illness with a persistent dry cough and a bit of a fever. But there are other things that can happen as well. Muscle aches, headaches, sore throat, extreme energy loss, feeling awful. When the disease gets worse, it tends to do so in the second week, but it can happen at any stage. And when it does worsen, being a respiratory virus, tends to affect the chest. So if it gets worse, it'll tend to start causing breathing problems when you're doing exercises that previously you were able to do no problem. If that starts happening, you need to phone for medical assistance. 111 is the NHS number, or your GP out of hours. Now, increasing breathing problems is the main reason that you would phone for medical assistance. But there are other important red flags to always consider as well. So if you have chest pain, or you have a terrible headache, or terrible fevers, or feel awful, or are getting slightly confused, or your lips look a bit blue, or you haven't been passing urine for ages, those are all good reasons to phone for medical advice and assistance. 111 would be the number of choice. Obviously, in an emergency, 999 is the number to call. Now, when you phone the medical professional, we've already said in previous videos that we'll want to know, can you speak in full sentences? And we will ask you about your respiratory rate and your pulse rate. It would be great if you've learned how to do that and you know the values now when you're well, at rest. Your respiratory rate, your pulse rate at the neck and at the wrist, and also the ROTH score. We teach you how to do those things in our previous videos, and if you can do that now and you know what your readings are now, you can then do it again when you're unwell, ideally as calmly as possible to keep your respiratory down to its lowest level. Now, that would be like having a paramedic at home. When we speak to you over the phone, the information we get will be much more accurate, and we can make good decisions on whether you're suitable to stay at home safely with follow-up telephone calls, or whether you need to go to hospital right now, or potentially a halfway house where we need to see you face to face and eyeball you in a hot clinic. So practice those things now, please. There are other things that you can do to make yourself more resilient, and that of course means eating well, drinking well, sleeping as well as possible, doing moderate exercise, as we've mentioned before. If you've got a dodgy chest, then doing breathing exercises, either deep breathing and then coughing, or doing the pursed lips breathing that we've already covered, or potentially using a PEP or an OPEP. These are devices that you breathe into against a little bit of resistance and they rattle and vibrate. It causes your lungs to inflate really nicely and also shake out some mucus to help you cough out sputum and cough out the virus if you've got the illness. That's why it's better to do that out in the backyard, or if it has to be indoors, in a room where nobody else is around, because you can spread the virus out. Thank you very much.